Uh, Good afternoon, everyone. Thank you for tuning in on this Memorial Day weekend. We will give a briefing today, but we will take Sunday off for the briefing and Monday as well. We'll produce numbers on Sunday for everybody. Monday, we're giving our health department the day off. So we'll be back at it on Tuesday. It's fitting this weekend that we remember what we've gone through over the last really 9 weeks. Remember the sacrifice that so many heroes before gave their life for our freedoms and our liberties. It means more now, at least in my lifetime, than it ever has. So unfortunately, we've lost 3 people today over the last 24 hours in hospitals. One was a Caucasian female over 100 years of age. She was actually 102, Stella Corona. And she lived a great and full life. And certainly we think about her and her loved ones. I knew her, and I know her family. We lost a Caucasian male in his 90s. We also lost an Asian female in her 80s. We've lost 115 people to COVID-19 in Onondaga County. So certainly, let's all take time to remember them and their families this weekend, please. Looking at testing, very busy testing. There have been now 30,433 tests done in Onondaga County. 29,277 tests have been returned. We received 1,413 tests since yesterday. We now have 1,836 positive cases since March 16th, 48 new cases, 27,441 negative results. We sent 1,009 tests since yesterday. We have 1,156 pending tests. Our percentage since we started testing is now down to 6.3% of the results that we've gotten have been positive. When we were doing symptomatic testing only, that number was around 8, a little bit over 8%. Now we're doing such broad-based testing, that number continues to drop. Over the last 3 days from the eClair system in the New York State Department of Health, our county has processed 1,500 tests per day. Remember, when we give you the report, that's how many tests we did that day. This is on the back end when the positives and negatives go into their system. And the average, 3-day average, 1,500 tests per day. Our infection rate in our 3-day average is now 3.1%. Our infection rate on the day is about 3.3%. So a lot, 48, again, this goes to our point. It's not so many how many cases now, it's the percentage, the infection rate, because we're doing so many tests each day now. There will continue to be universal testing at the Syracuse Community Health tomorrow, and it will be closed on Monday. Back open the rest of the week, regular hours, 9 to 5, but nobody working Monday. Tomorrow, limited hours, so if you want to get a test tomorrow morning, please go to the Syracuse Community Health Center. Again, that's for folks who are symptomatic and asymptomatic. Mobile testing next Wednesday, May 27th. We will be testing at Lafayette High School from 9 to 5. And then Thursday, May 28th, we will be testing at the Syracuse Community Health Center site on East Genesee Street from 9 to 5 as well. You can go to our health department website and pre-register for a time slot, or you can just show up. Regional testing. Remember, our mandate is on average 775 tests a day. We've been doing very robust testing, so we can really take Monday off. There still will be some testing Monday, I'm sure, at the hospitals, and still meet our mandate. Looking at the last 24 hours, yesterday we did 1,526 tests, essentially double what we need to do. Our 7-day average is now 1,310 tests through May 16th through May 22nd. So we are 535 tests on average, more than what we're mandated to do as part of our restart. Hospitalizations are down 4, 79 individuals in the hospital. Out of the 79, 51 of them are folks waiting to be discharged. So the reality is we now have 28 individuals in the hospital that need to be there for the services. I spoke to Governor Cuomo today on this matter. The governor understands that we're working for a solution to locate a nursing home that will be a COVID nursing home or a separate wing, a separate transitional facility to handle these individuals who are COVID positive. They go to the hospital. They then are healthy enough to be discharged from the hospital, in some cases recovered, but they still test COVID positive. Remember, once you have COVID, you may test COVID positive for an extended period of time. Could be weeks, could be months. We just don't know yet. So these individuals don't need to be in the hospital anymore. We talked to the governor about it today, and the state agrees. So we're working on a solution for that with the state. So it was good to talk to the governor, recognizing that this is an issue, not just in our county, but we're excited about the fact that when you take these folks and we get these folks back into another facility, and eventually we're going to get them back into their homes, we only now have really 28 individuals in the hospital that really need the care, and that's important. We have 17 individuals who are in critical condition. This is down 3 from yesterday. And so, again, we like when that happens. Again, let's keep these 17 people in your thoughts and prayers. They're folks that are really in a fight, and many of these folks need help to breathe. So let's keep them in our thoughts over the weekend. To date, we've had 216 people in total that have been released from the hospital. That's up 7 from yesterday. And again, we now have 48 new cases over the last 24 hours, 48 new cases out of over 1,400 tests back, 1,836 positive cases over this period of time with this fight with this virus. Our 3-day average is 53% of the cases are asymptomatic. That's important for the community to understand. These are folks that either are working in facilities that are now getting tested twice a week that are not sick, but they're asymptomatic. They're still carrying the virus, so they still could be contagious. That makes sense if you think about it. We know COVID is in nursing homes. We know COVID is in senior facilities. There's exposure, even if it's limited exposure for the employees. So that kind of makes sense. But the community spread numbers, we're seeing asymptomatic cases as well. So these are folks that went to get testing. They were curious and got a test. They've had some sort of exposure to COVID. So we need to really, really remember that when we're out doing our daily activities, when we're outdoors. It's beautiful outside. If you're at a park, if you're at the zoo, if you're at Oneida Shores, you need to wear a mask. And certainly, we want people to be cognizant of this as they're having barbecues, small gatherings. Even though people are feeling healthy, they may have had exposure and they may be contagious. So please do this for yourself, your children, your loved ones, and your neighbors. Looking at the 48, we now, 8 of these are related to senior living facilities. It's good. We want that number to be down, especially residents, because there's a direct correlation with residents of these facilities and then hospitalizations. So 8 is on the lower end of what we've been seeing. 15 individuals are household contacts. These are folks who are already in a quarantine, loved ones of someone who was tested positive for COVID-19. They now have symptoms. We deem them positive with COVID-19. And then we have 25 individuals from the community at large. Again, 53% of these cases are asymptomatic. We never would have known about them if we weren't doing the type of testing we were doing. So we now have 1,927 people in isolation and quarantine, which is certainly big numbers right now. As we have more people positive, we got to have more people through our contact tracing and quarantine. Our active cases are actually down 29 today. Our active cases are at 736. That's because we had 71 recoveries since yesterday. Our recoveries are now at 990. So 990 people have recovered. Active cases, even though we had new cases today, are down because of our large recovery number. And infection rate down on the 3-day average, good infection rates. When we look at our total cases, 1,086 female, 750 male, 74 under 19, 297 in their 20s, 225 in their 30s, 227 in their 40s, 300 in their 50s, 238 in their 60s, 186 in their 70s, 179 in their 80s, 110 in their 90s. Breakdown by municipality. First is total cases, second is recoveries. 1,007, City of Syracuse, 491 recoveries. 147, Clay, 103 recoveries. 129, Onondaga, 35 recoveries. Geddes, 94, 30 recoveries. Salina, 83, 56 recoveries. Manly is 67, 55 recoveries. DeWitt, 66, 53 recoveries. Cicero, 62, 35 recoveries. Camillus, 58, 38 recoveries. Lysander, 34, 27 recoveries. Pompey, 25, 22 recoveries. Van Buren, 23, 9 recoveries. 15, Skaneateles, 15 total cases, 15 recoveries. Marcellus, 7, 5 recoveries. Lafayette, 5, 3 recoveries. Atisco, 5 recoveries. Elbridge, 3, 2 recoveries. Fabius, Spafford, and Tully, all 2 cases, 2 recoveries. Reminder, 53% asymptomatic cases last 3 days. Please, 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 physical distance, wear a mask. We're making tremendous progress as a community. We are in very good shape as far as a region to move to phase 2. We'll be moving to phase 2, but we need you to continue to lead so Onondaga County can continue to help have strong numbers, not just for ourselves, but for our region. Restart today. I was at the Oneida Shores beach earlier. Very good. Happy to report things were going very, very well. A lot of physical distancing. Again, to get onto the beach, you were wearing a mask. You were also you also had a temperature check, and then we had the beach sectioned off in 3 sections, and we had lots of staff there to make sure that each group was at least 6 feet apart from each other. So very happy, very proud of our team. And then we went to the zoo. Again, to get into the zoo, appointment via reservations or calling ahead. You needed a temperature check, masks. The indoor section of the zoo was shut down, no food at this time. But again, I took a walk through the whole zoo. You wouldn't even have known that there were many, many families there because of how easy it is to physical distance in the zoo. So it was great. I know that people and families are enjoying themselves. Certainly want to remind people you need to become a member at your zoo. It's the best zoo in the country. So please look at that and get your membership for the zoo and get your kids out there. It's just a great experience. Also, on our regional call, another 50 or so businesses signed up, attested on the New York Forward page. That's good. Everybody's getting excited as we start to move towards phase 2. Questions? Terry, it might be just you today, so we can have a conversation, Terry. Yeah.
Questions. You mentioned the woman who died, who was 101. Is that
102.
Sorry,
Yeah.
102. Is that Stella Vallone?
It could be. It could be Stella Malone. Corona is their my friend
Okay. Okay.
who was the her grandson.
Is that the oldest victim we've had?
I don't recall. Usually, I get the age. I don't recall having someone in their been around for a century. Stella obviously was alive during the 1918 pandemic as well. So, that I don't recall having anyone be over 100 at this point.
And did you know her, or you know her family?
Their grandson and their family. Yeah.
Okay. All right. And I wanted to ask about the numbers. I believe yesterday we reported 109 total deaths, but I think today you said 115.
Yeah, I think we had 119. Or no, 109. Yeah, we had 3 new ones. I believe the New York State, at some point over the last few hours, updated 3 more individuals we lost in nursing homes.
Okay, so 3 new nursing home deaths recorded by the
I'm not
state.
exactly. I'm not sure the exact timing of that.
Right.
Yeah.
And then for us, it's another 3 over the last 24 hours.
Correct.
Okay. All right, thanks. So I wanted to ask about churches. I understand the diocese is making efforts to start Mass again next weekend. And I understand there's been a request from the bishop to work with the state to try and go from a minimum or a maximum of 10 people at a religious gathering to perhaps a 25% capacity. Is that right? And where are you with that?
Yeah, so we
effort?
put that request in for consideration for phase 2, and we haven't heard back yet. I know that the governor set up an advisory council. I talked to the bishop. Since then, you've had the president deem religious institutions essential. So I think this is something we need to give good communication and clarification on. We're willing to work with various religious institutions for outdoor services, and I know some of them have already had them. But I think we look at all this based off of, let's just use common sense, and let's put ourselves in a position where we gradually bring things back to where we were. So if you have a building that is very large, I think of my church, even when you have a lot of people in the church, it's very easy to physical distance. And so to bring this up to 25% capacity, then 50, then 100, is good, and it makes sense. So we're advocating for that. I know that there's been examples across the state where there was gatherings, and you think of Patient Zero in Westchester County, how various religious gatherings he went to, and it led to outbreaks. So we know it can, how potent the virus can be. But if we know about the virus now more than we did when Patient Zero didn't even know that he had it. So I think gradually moving into this makes a lot of sense, and I think a lot of our religious institutions would appreciate that. So I think we need to find communication on this week before we get to next weekend, where somebody can say, the federal government says X, the state says Y, well, we're going to do what the federal government says, and then people are calling saying there's more than 10 people at a service, can you enforce it? So we need to get this thing right.
Do you have a sense of when you might hear back from the state on that?
I don't. I don't know where. My hope is that the advisory group that's been meeting, that the governor put together across the state, is having conversations and making recommendations quickly. I think the governor will probably wait to hear back from them, would be my assumption. But it's certainly, I think, something that we got to have this week. Nobody was prepared for this, right? So there's not a lot of gatherings at religious institutions probably this week, but next weekend, it's out there. We can do this. We can do this safely, and we can use common sense. Let's try to get it done.
All right. It sounds like you had a productive conversation with the governor today. How close are you? Have you already identified 1 or 2 nursing homes that might fit the bill?
Yeah, we're looking at that, and we're looking at other potential wings of hospitals where these folks need care even though they're healthy, so it's not as easy as someone being discharged to their home. So we're talking about it. Some of our nursing homes that have COVID units are larger buildings, so making it a COVID-only building in one of your larger ones logistically might be a challenge because moving people in and out who are COVID negative it could be very disruptive. So we're going to figure it out. I was very happy. I spoke to the governor and some other county executives from the largest counties. Had a conversation because regionally we probably have to figure out an answer for some of the smaller counties as well about this. So we had a good conversation. I've been talking about this for all week. So I'm glad that the state's recognized it, has seen it, and has given us the green light on a couple things that they would certainly feel comfortable with, being COVID, nursing homes, transitional facilities for these folks, and it meets the intent of what the governor was trying to do with his executive order, and solves the problem with people just sitting in a hospital.
You think we'll have a solution by midweek? Or?
Yeah, we will.
Okay.
We'll get this done.
Good. You mentioned the remote testing sites next week. That's Tuesday at Lafayette High School, and then Wednesday at the Community Center on East Genesee Street.
It's actually, Terry, I think it's Wednesday and Thursday.
Okay.
Let me just confirm that. Wednesday at Lafayette High School and Thursday the 28th at the Syracuse Community Health Center on East Genesee Street.
And you mentioned people can sign up on the website, but can anyone go? Does it need to be someone who's already back-phased into the workforce?
Anybody can go.
And they're free?
Yes. Well, for them, yes.
Okay.
If someone's paying the bill. But yeah, for them.
All right, great. Anything unusual or stands out to you, what you saw today, both at the beach or at the zoo, how people are adjusting to this new way?
I thought it was at the beach, it wasn't as busy when I was there. I was there earlier, so it got a little bit nicer after I left, so I'm sure it picked up. But the zoo, I was just so impressed in how the communication inside the building, they painted feet. They did not use my feet. I don't know whose feet they used. They were very nice feet. Communicating each way. It was great to see the families out, seeing the animals. I think many of the animals miss the people. And so it was just a very nice thing. And certainly our staff at the zoo should be very proud of what they've done because we're the first zoo to open up in New York State. And they did it in a very safe way, and this will be the model for other zoos to open up as well. We already have other zoos contacting us about this.
And so we're the first one in New York State?
Yeah, it's my understanding.
Okay. And were kids running around? Were they?
No, kids were with their families, and everybody was going from exhibit to exhibit. Some exhibits we cut off some of the areas. We don't want kids and people leaning and touching on certain things. So I would highly encourage, Terry, you to maybe register. And you can get, I got about 2,000 steps in my step count at the zoo today to help with our little challenge that we talked about yesterday. So it was really nice, and they did a great job. And I want to encourage everybody to, it's a great thing to do with your family. And it brings you back to kind of feeling normal a little bit, even though you're wearing masks when you're within people and everything else. It was just very nice. It was very nice to see families enjoying it.
What do we have to look forward to next week? What other, besides churches and dealing with the nursing home?
Yeah, I think we'll have this situation handled with getting these folks discharged out of hospitals. I think when you look at it, we're going to be getting more and more testing, more and more data information. So that will, we look forward to that. Our hospital numbers, Terry, knock on wood, 79 minus 51's, it's a good number. That's the best number we've been at in a long time once we get these folks discharged. And we're going into phase 2, so, a little bit of excitement there, but at the same time, we got to make sure that we're being very smart as phase 2 comes open. So I think there needs to be a lot of communication with the business community and groups like McMahon's and Center State talking to their members about how to do this and do this right. Last thing you want to do is get open get going and then lose employees to quarantines because of various things, because then you're kind of right back where you are. So businesses need to be smart with physical distance within their own facilities. Again, just because you're allowed to be back in the office doesn't mean you have to have everybody back in. And certainly, if businesses are interested in having their employees go get a test to come back in, phase 2 could start on Friday. If people are going on Monday, that means that, or not Monday, Tuesday, that means you'll probably have some results back around Friday and whatnot. So these are all things that businesses should think about. And I think it will be exciting. For those of us who are downtown every day, phase 2 is going to bring back density to your downtowns, and you'll see more people. It'll give you that sense of things coming back a little bit to normal and progress, but at the same time, that there's more risk with that. So we need to just find that balance.
The governor said today that the 2-week intervals between the pauses is not a hard and fast rule, that if the numbers look good, it could be shorter, but if the infection rate goes up, it could be longer. Do you have a sense for how long our phase 2 might really last?
I don't. I think the 2 weeks, we're comfortable with the 2 weeks. We've always said 10 days gives us a trend. Look at if we see through phase 2 the first week indications that the virus is really weakening, then I think you'll see that trend statewide, and there might be an interest to maybe look at things. I think some of the things that maybe you can do is maybe you can rearrange the deck of the types of industries in each phase a little bit. You learn a lot in this. In this whole process, it's amazing how much you learn in a week. So I think, to the governor's point, phase 2 is going to teach us a lot. And then whether you need 2 weeks between phases, or whether you can do some different things and maybe combine phases with some of this, or move one industry from phase 4 to phase 3. These are all things that I think you can learn, and I think phase 2 is going to teach us that. Phase 2 is really where we're really giving the virus an opportunity to expand, because more density, but we know more about this virus now than the last time everybody was together.
All right. Thank you.
Thank you, Terry. And again, I want to thank everybody. I know this has been a process. We've been tested as a community and with this virus, and we're making so much progress. And we're getting back these freedoms that were limited for a short period of time. So I just think it's appropriate that on Memorial Day weekend, we think about everybody who's paid the ultimate sacrifice and gave their life for these same freedoms that now should mean so much more to all of us. And I really want to think about our Gold Star mothers and our Gold Star families who play such a meaningful role in this weekend traditionally, and they still do. And let's think about them as they have paid the ultimate sacrifice with the loss of life serving our country. So please be safe. God bless everybody. And remember those who have fallen for us, and God bless our Gold Star families.